share my screen. Hopefully this is going to work. So, are you seeing my screen?
Yep, that sounds all good.
Great, okay. So, well, no, I'll follow my plan. So this is about really mainly about sourcing open data and collecting your own data. So there's lots and lots of information that's available from the public sector, and what we're going to be looking at is how you can find different online sources of open data that might be useful to you and your organization, and how to design the collection of your own data in such a way that it'll be useful for analysis and making decisions. The outcomes of this hopefully will be an expanded knowledge of the wealth of data that the public sector uses and is required to share, skills in making the data useful and making your own collection, and an understanding of how you can potentially put together stories, narratives, and so on with data that's publicly available. Last week, I ran a workshop, and I don't know how many of you attended that, but it started off with an introduction about data, and then moving into spatial data, statistical geography, and visualizing data. So the key point really about data in general is that it's something that's more and more important in Scotland and in the UK. It's being used by government and businesses to increase productivity, but it's not yet having enough of a positive impact, in my opinion, on marginalized groups in our society. And that's not only my opinion, but also based on data. We talked about different kinds of data, including definitions for open data, open government data, big data, and so on. And I ran through some examples of that. All of this is available, I think, online in the recording of last week's session for anybody who wasn't able to be there. With regard to government open data, something that I'd like to highlight again is that the UK is really, this is a world ranking from the Open Data Barometer, and the UK is really kind of up at the top with a great amount of open government data available. In talking about geospatial data, this is data which is specific to a particular area, a particular point on a map, or a particular shape within a boundary. And I explained how quantitative information can be attached to shapes on a map in order to help visualize things that otherwise you wouldn't be able to see. A very simple example that I described was how to take very simple information from an Excel spreadsheet and project it onto a map. So, for example, in this case, placing on top of a shape the name of the shape and the temperature, and the way that you could then change the temperature and change the way that you visualize that shape. And then later on in the presentation, I explained one tool that you can use for doing that. I then went on to talk about statistical geography. And within the United Kingdom, there are a massive number of different boundary shapes which are used by various different government organizations and different governments in order to carry out their work. And a lot of the open data that's available is categorized according to these specific statistical geographies, and so it's useful to understand how those work. I went on to talk about visualizing data, and in this case I focused particularly on the use of a tool called QGIS because of the fact that it's very powerful, it's free, it's got loads of online support, It's supported by a massive worldwide community of volunteers, really, and it's much easier than it looks. So that was the website for downloading QGIS. So now I'll get started with talking about sourcing open data. For those of you who were with us last week, the presentation was very much me sharing my own knowledge with the audience. However, there's a term used in the world of data and computing and so on, which is a single source of truth. This is a kind of a goal of many organizations, is to have everything in one place so that you can source everything from the same place. But unfortunately, it doesn't really exist. And I'm not going to be able to tell you today about where to find absolutely everything that might be useful to you. I know that you're predominantly in Scotland, and there are many different sources of where that data can come from. And so in this session, it's going to be more collaborative. We're going to be using breakout rooms and so on in order to have discussions between yourselves, because you actually, between yourselves, have a lot more knowledge than I do. So I started last time with having collected some information from the third sector jobs website, looking at the number of jobs by sector, because I thought this might be an interesting way of establishing within the third sector what the what amount of employment there is within each subsector. We then did an online poll and established that there were some similarities with regard to the study that I'd done previously and the attendance, but also some differences. Now, what I'd like to do now is, because of the fact that we're going to be splitting up into breakout rooms later on in the program, is to carry out this survey again to check that the numbers are still more or less the same. So hopefully this is going to work. Okay, so I'd like to ask participants to go to www.menti.com and introduce this code and answer the question, which one of the following areas best describes the work of your organization? Then we'll have an interesting comparison between the attendees last week and the attendees this week, and a way to divide people into groups. I'll give that a couple of minutes for people to respond. Oh, we have a much greater representation of people working in the children and youth sector than we did last week. Okay, it's still going up slightly, so I'll give it a moment more. Okay, we seem to have reached a point where the votes are slowing down. So let's compare that. Okay, we got 46 votes and I think an attendance of 58. So I think that's probably where we'll stay at. And actually the representation is rather more similar to my hypothetical. I'm sorry, I've lost my PowerPoint presentation. So, I don't know if this is still going to work as well as it was planned, but I was planning on breaking people out into breakout rooms based on their voting preferences. And so, depending on what category you voted for example, health and medical, you would then be allocated to a breakout room, which is called health. Social care and welfare, faith-based, children and youth, I put into a category called welfare. We'll see how this works in terms of numbers and if there are any rooms which don't have perhaps more than 3 or 4 people in them, then maybe it would be better to join one of the other breakout rooms when we get to that stage. So within the breakout rooms, what I'd like you to do is that the person with the name which is lowest in the alphabet, such as Adam, for example, will be a spokesman for that breakout room. And the person with the alphabetically highest name, like Zoe, for example, will be a moderator to help to organize the conversation within that room. If you're uncomfortable in the role that you're given, then please ask another participant to replace you. So I'm going to give you, I'm going to start off by talking about some work that I'm doing at the moment, some examples of the way that I source data for projects that I work on. So I'm working on a project at the moment with a team of people, which is looking at the idea of a hospital as an anchor institution. The idea of an anchor institution is that a large employer, for example, like a hospital in a town, might be able to provide a lot more benefit to the community that it's based in than purely its function for curing people. And so we have a kind of a fairly loose hypothesis, which is that the location of a hospital relative to the population that it serves, the residents of the workforce, where the people live, its relationship to the town centre and to public transport, all of those things impact on the hospital's ability to improve population health and well-being, all kinds of well-being, through who gets employed, who gets trained, all sorts of issues. The geographical scope of this study that I'm doing at the moment is England. And so some example questions that we've come up with as a team for this particular project are, number one, to what extent does the location of a hospital impact on a community's access to services and on carbon emissions, and how is the English NHS doing? How many jobs do hospitals create? What's the impact of workplace location on the way of life and spending behaviour of the staff? As often the single largest employer in a town, what patterns can we see in the relationship of the town to the hospital and in health inequalities in these towns where the high street's declining? Or rather in those towns where the high street's declining, which is something that is very much in the press at the moment throughout the United Kingdom. And finally, what relationship exists between hospitals and public transport, like railway stations? When might this be more important? So what kind of data can we use to answer these questions? So we're looking at the first question, which is about the impact on the community's access to services. The information that we need is where are hospitals, but also where is the population, how is the population distributed, and what are the travel distances or travel times between the places with the densest amount of population and the hospital. Now, what you see now is a 3D projection of the population of England. And this has been produced basically from the QGIS tool that I talked about last week, and is totally based on open source data, which is downloaded from various government websites. So I'm going to leave the PowerPoint for a moment and talk through a little bit this particular study. This is really just to get you thinking about various different sources of data and how they might interact with one another in order to inform knowledge. So within England, last week I talked about statistical geographies, and the smallest statistical geography that exists is called an output area. The same term is used in Scotland. And output areas are shapes on a map. And those output areas have a population of about 300 people per output area in the case of England. Now, because of the fact that statisticians have worked out how the people are distributed within those output areas, there are files that can be downloaded which are about the population weighted centroid of an output area, which is the point where there's the greatest level of population. So if I switch on this layer on this map, each of these red dots is the center of one of these shapes with a population of 300 people. Now, using this tool, I'm able to convert the density of these shapes into contours, which hopefully will work here. Yeah. So I'll switch off the map in the background. And now you can see the way that the population is distributed, forgetting about all of the artificial boundaries which are created for administrative purposes. I'm then able to compare, or rather, I'm then able to identify the peaks of population, the places with greatest density, which are highlighted here in yellow, and specific points, which is the center of that shape. And this is useful to me because what we can then do is we can look at the position of hospitals and see how the position of those hospitals is related to the point of greatest population. And it's quite typical, because of the history of hospital building, that hospitals have shifted to the outside of towns where there's more availability of land. But our argument is that that might have an adverse impact on the hospital's potential positive role as an anchor institution. So within this study, we've also we're also interested in declining high streets. So how can we identify declining high streets? Well, there are various different organizations that are working on this particular problem and have produced lists of places that are declining. but we wanted to have a little bit more rigor than just using somebody else's list. So what we did was to look at the, to get data from government data about the number of businesses in a particular location with a time series. And so looking at a time period from 2015 to 2019, which was a time when in general the economy was growing, there are certain places which in this case are called middle layer super output areas in England. In Scotland, they might be data zones. And let me find this. Okay, so these shapes, which are highlighted in a rusty red color, are all places where the number of businesses in the center, which coincide with, they're places where the number of businesses actually declined from between 2015 and 2019. And so knowing that, and if I pick out those places which have a hospital, then I can identify places that have town centres or high streets where the number of businesses has dropped over time. Moving on from this, many of these places also have train stations, and I've identified that we're also talking about the position of high streets. I'll go to somewhere a bit more. So if we take an example of Kettering, we have a hospital in this location, a high street in the red hexagon, and a railway station in the green hexagon. And I'm able to, using open data through through this same program, we're able to identify the shortest walking routes between each of those, between the hospital and the train station, the hospital and the high street, and the hospital and the centre of population, which I don't have highlighted here. Filtering out those places which are filtering out the places which are of interest to us, which are places which have a combination of, let's say, a struggling town centre area, a hospital, and possibly a train station. We're able to extract information from this with regard to those distances, but also to look at other kinds of information. I'll go back to the presentation. Sorry. So first of all, we're looking at the population density, travel distances and times, and hospital locations. How many jobs do hospitals create? What's the impact of location on the way of life and spending behaviour of staff of an out-of-town hospital? So, for example, we can get staffing numbers, employment numbers from the National Health Service, which are both available as full-time equivalent jobs and as total headcount. We can look at demographics, and from data with regard to the employment of people within particular geographical areas, we can identify where most public sector workers live. And in many places, a large proportion of the public sector workers will be working for the hospital. So we can identify where those people are living. And we can also look at data on spending, financial data on salaries, for example. The third question we were looking at was, as the often single largest employer in town, what patterns can we see in the relationship of the town to the hospital and in health inequalities in those towns? So here, as I described earlier, we're looking at time series data on the number of businesses in small geographical areas, looking at the locations of high streets and of hospitals, and also looking at the indices of multiple deprivation, and particularly in this case of health in the domains of health and of employment for the areas which we've identified as the centres of population. What relationship exists between hospitals and railway stations? So for that we need the locations of those two places, and the travel times and distances between them. So this is an example of questions that we ask ourselves based on an initial hypothesis, and of the kind of data that we might find useful to analyze in order to answer those questions. The second example I'm going to give you, I've called Where Should I Live? And this is because, as I was explaining to Jen earlier on, I've actually, I'm speaking to you from Seville in Spain at the moment, and I've been living in Spain for about 15 years, but I'm about to move back to the UK, and I have, I'm going to be working on the south coast of England in Hampshire. It's an area that I don't know very well, and I don't know many people in that area. And I've got 3 school-age children, and so the questions that I would ask, that we are asking right at the moment, are, for example, where are the best schools? Because I can be fairly flexible with regard to where I live because of COVID creating a situation where workers are likely to be only required in the office 1 or 2 days a week, and so the weighting of being close to the office for us has dropped. Secondly, how do house prices vary? With a limited and not very large salary, it's going to the lower house price could be, the more cash we might have available for other things. What are the cultural and outdoor leisure offers of the area? And how can we get around sustainably and affordably? We wouldn't want to be in a place where we're constantly reliant on 2 cars. So the kind of data that I'm looking at right at the moment in this example, in England, we use Ofsted ratings. There's a Scottish equivalent, and so Ofsted ratings and school locations. How do house prices vary? There's house price data that's available, published on government websites. What's the cultural and outdoor leisure offer? So here, for example, it might be interesting to look at information from historic England. For example, there are places that have a higher density of listed buildings, and so I know that those places are more historic. There are national parks, and my children are all keen surfers, and we're moving to a coastal area. So my oldest son has provided me with links to websites of surf forecasts so that we can identify where there are beaches that might be possible places for surfing. And how can we get around sustainably and affordably? Well, there's data published on railways, there's data published on cycle paths, and on cycle storage. So I know that if I'm living close to a train station that can take me to my work, and that if there's that train station has a cycle storage facility, then that's answering a lot of the questions about places where we might locate to. Going back to using the QGIS program, this is Hampshire. The red, unfortunately, the greater density of red is higher house prices, and we can see that kind of spilling southwest from London. Unfortunately, we're not going to a very great area with regard to living affordably. And the blue diamonds that you see here are schools which are rated as outstanding. So that's a starting point for us to start to investigate an area that we don't know and that we're going to be moving to. So we did the survey earlier and the results came back a little bit different, but we'll stick with the original plan for breakout rooms. I'll go, sorry. I'd like you to go into your breakout room. I'll put the slide back on with the names of the rooms and the sectors. I'd like you to go into your breakout room, and for 10 minutes, so the idea is that the breakout room should be organized in such a way that there are people with similar interests. I'd like you to discuss in your group and reach a consensus on five issues which would be useful to study in your particular field of work, in your particular sector, if the data were available. The data might involve changes over time in some factor, correlations between one thing and another, or geographical distributions. So in 10 minutes, we'll reconvene, and the spokesperson for your group, who is the person with the lowest name ranking alphabetically, will read out the 5 questions that you've reached a consensus on to the group. It would be useful if you could, if somebody in the group could type those as you're discussing them, so that when we reconvene in 10 minutes in this main room, they can be pasted into the group chat. So I'll go back to the correct list of breakout rooms, and if Jen, you could now set up for those rooms to be joined.
Yep, no worries. So you'll be able to choose, it should have just popped up on your screen now, which room that you're best placed to go into based on the area that you work in. If anyone's having any issues, just give me a shout. I'll wait in the main room just now in case anybody has any issues. But
and if you find yourself without enough people in your room, then please go and join another one.
I think that's everybody back now, Tim.
Brilliant. Okay, welcome back, everybody. So in your rooms, hopefully you're all clear who your spokesperson is. And what I'd like you to do is for somebody from the group, if somebody from the group has written down the issues, the questions, to post that into the chat now on behalf of your group. And I'd like the spokesperson from each group to share with everybody what the questions are, which are pertinent to their group. So let's start with the community group. Do we have the spokesperson from the community group?
Yes, hello.
Hi.
Sorry, I was just typing my notes up so that I could paste them more easily. Yes, we talked about the location of community organisations relative to council services.
Yeah.
We talked about transport links in the community. We talked about the location of community organisations compared to funded services. So the first one about location was more thinking about whether they were distributed evenly, you know, if you're thinking about islands or more rural locations, for example. And the second one was more about whether those the location of services of community organisations increased in relation to the number of funded services decreasing. And then we also thought about that in terms of funding in general, whether the amount of funding given to community organisations increases relative to the actual funding from local government. And then we also wondered about funding cuts versus life expectancy. And I'll post those.
Excellent. Sounds like really, really interesting stuff to investigate. Can we have the culture group, please? The spokesperson from the culture group.
Hiya. So yeah, we kind of realised we were kind of from fairly disparate areas, but all with some links. So sort of looking at the culture and arts overall with a connection to education, then there was a few people that sort of specifically worked in fundraising in those areas. So our 5 questions that we came up with were just generally looking at what is their SIMD of the area, trend of prevalence of dementia in local authorities. That one was specifically related to a dementia project, but I guess, you know, it could be related to any kind of like health issue or mental health issue. How close are schools to other cultural resources, and how does this relate to the proximity of the population? And again, schools, I guess, could be replaced by hospitals, care homes, whatever. What types of cultural venues or organisations are these? And do these cultural organisations have outreach programmes? So I guess kind of quite a lot of interrogation there into like the venues themselves and how they relate to the communities in which they're situated or are attempting to engage with.
Brilliant, thank you.
No worries.
Let's have inclusion, please. The inclusion spokesperson.
Hi, that's me. We came up with a number of different scenarios, which mostly seem to revolve around reductions in services in rural areas. The first one was really particularly looking at public transport and the growth of sort of on-demand public transport against regular bus services, which people are finding quite difficult to use. In an area where you have to request these things by using online forms of communication, there's a barrier there immediately with people who don't have either the connectivity or the technical skills. So it was looking at that mapped against where people live in terms of the rural area. The second thing was about accessibility to affordable food. And again, looking at public transport in rural areas, meaning that people in smaller rural areas basically have to rely on their local shops rather than being able to travel to a larger supermarket to get stuff they can afford. And the third one, which was the final one we looked at really, was about restricted travel for young people who maybe have to travel way beyond their normal communities using public transport, some of whom are unable to do that independently due to other disabilities or conditions, health conditions, and the access links between where people go to school, where people go to for health appointments, and mapping that against local transport. I think that's everything.
Excellent. So in the in this inclusion group, there was a particular focus on accessibility and transport, by the sound of things.
Yeah, and a number of the members of the group were particularly functioning in rural areas where things had been recently cut. So that was one of the reasons they were looking at that.
Thank you very much. And the welfare spokesperson, please.
Hi. We're actually very similar to what Adam has said. We have focused on accessibility as well. We were looking at numbers and geographical mapping of internet access to identify areas that might have poorer access, and then go in and support and maybe helping like with funding, applying for funding for electronics. Then we also looked at data for volunteer recruitment. So giving like a bit of a geographical mapping to volunteers could help them identify what spots are closer to their house and makes it easier for them to volunteer in different services. We also look at geographic data for setting up outreach services. So identify what service users are in rural areas and opening rural hubs there to address gaps in service. And we just looked at mapping as well for certain conditions. So people with different diagnoses, where do they focus, and does everybody have a diagnosis as well? Are there people who are trying to access support, but they don't have a formal diagnosis, which that would indicate as well gaps in support? You know, maybe they're on a waiting list, but still require that support. So services need to come into that area and cover them gaps.
Great, thank you very much. So now in the next step, I'd like Jen to set up breakout rooms again, and in the same groups, what I'd like you to do is to have we got those things pasted into the chat now?
We've got some of them, Tim.
Right.
We've got community and arts and culture, but if
could we, would it be possible to have the inclusion and the welfare?
I wouldn't have the skills to do that. Hopefully someone else in the group might be able to.
Oh, right, okay. Well then, what I'd like to happen then is you go back into the same rooms, with the exception of the spokesperson, okay? So what's going to happen now is that each group is going to look at the questions or the issues that have arisen from another group and think about where that information might be able to come from. Because of the fact that the welfare and the inclusion groups both had fairly similar kind of things, I'd like the welfare people to look at the issues from the inclusion group, and the inclusion group to look at the issues from the welfare group, and similarly a swap between the culture group and the community group. I hope this isn't too mind-boggling. So the activity here is you've got 15 minutes to look at what sources of data might be useful to your neighbouring group. And you're encouraged to think outside of the box. So perhaps the specific question that you're trying to answer isn't readily available, but there might be other ways of answering it. And this activity should involve identifying possible sources for the data, and if possible, actually providing links to sources of the data if it's available online, and if somebody can find them. So it says 10 minutes here. In 15 minutes, we reconvene again, and the spokesperson for your group tells us what. Hold on, this isn't going to work because the spokesperson is going to be going into the other group. The other person who was named as the moderator will explain the data sources they've thought of for the group that they're talking about. So I'd like everybody to go back into the breakout rooms with the exception of the spokesperson. So the spokesperson for the culture group enters into the community group in order to be able to brief them. The community group spokesperson into the culture group, the welfare spokesperson into the inclusion group, and the inclusion spokesperson into the welfare group. Let's see if this works. Maybe I've made it terribly complicated.
If anybody has any issues, just well, I'll open up the breakout rooms and then just give us a shout if you're not sure where you're meant to be. But I'll open up the rooms now. Is it 10 minutes again, Tim, or 15?
Sorry, 15 I think is better.
Okay, doke. That's everybody back, Tim.
Okay, great. I've lost my Zoom screen. Bear with me a moment. Sorry, everybody. I'm fighting with Zoom, trying to find the window. Okay, back online. So I'll share my screen again. Screen 2, share. Okay, so now each of the now that each of the groups has looked at the other groups, I'd like the person who I defined as the mediator earlier, the person with their name highest in alphabetical order, from each of the groups to explain what it is that they've talked about and what ideas they've come up with for where the other group might be able to source their information from. So if we could start with the representative of the culture group. Do we have a...
So we were looking at the community. Is that the one you want me to do then, Tim? Yeah.
Yes, yes.
Yeah. Just making sure you weren't wanting it the other way around. So they were wanting to find out about the location of community organisations relative to council services, comparing that to funded services as well, to look at what the sort of funding levels were like for community voluntary organisations, and looking at levels of funding centrally versus funders as well, so from central government funders, and looking at funding cuts versus life expectancy as well, and transport links in the community. So there was a few websites that I'll happily post into the chat if people want them, that we had some knowledge of. So there's one called 360 Giving, which is reliant on people obviously sharing their data. But an example that's on there at the moment is there's a COVID-19 grants tracker, which is quite a nice little tool we've got there. So you can have it just as dashboard information, or they also have it as map information where you could go in and look at the heat map on it as well. So that's quite good. Another one that we were aware of was statistics.gov.scot/data, and there's over 300 open data sets in there, ranging from education to policing, to court information, to housing information. Basically, I think anything that the government, Scottish Government, actually want to share, data set wise, seems to be in there. So that's probably a really good starting point for people if they're looking for something. And the other one that we looked at was looking at around the Marmot review, which Emily had told us, you know, focused on England, on that, looking at the funded cuts versus life expectancy. But when you do a Google, you do find that obviously NHS Scotland, Public Health Scotland have obviously looked at that as well. So we didn't find a particular site that showed you any of that information. But the fact that, you know, it's coming up on those sources when you're looking at it, there'll be open date on it somewhere, I would think. And I think that was us. So
thank you very much. And so your counterparts were the community group. Could we hear from the community group?
I think that fell to me to feedback, and I didn't necessarily take copious notes because I was very much engaged in the conversation. So I suppose the start of our first question is, what is the SIMD of the area? Now, that was quite an easy one, so I was delighted to get that one. You can obviously download the Scottish Index of Multiple Deprivation, and then using things like the QGIS software that we've been looking at, you can use that to map particular areas if you're looking at applying different things to that. There was a question around the trends of prevalence of dementia in local authorities. Now, Public Health Scotland have information on their website, so I've got a link and a couple of links, I'll pop that in the chat. But actually, from our own experience, if you actually reach out to the public health team and set out what information you're looking for, they're usually quite forthcoming with that. So you'll be able to get, I suppose, information around the number of individuals diagnosed with dementia. It might not go into great geographical detail, but it will certainly give you a picture for the area. The next question was, how close are schools to cultural resources, and how does this relate to the proximity of the population? That was a bit of a challenge. So we were looking at whether you would be able to pull information pertaining to where schools were from local authorities, and then look at mapping that with some of the data that you could potentially get from either Scottish Government or your local third sector interface around where organisations are. We also talked about OSCA, so I don't know if those in the call are aware, you can download the entirety of OSCA's database, providing you agree to a couple of conditions, which will then map, you'll get information around the postcode and area of delivery for every charity on their register, and you can then filter that out by local authority area. So by mapping those two sources of data, it will give you a fairly good picture, not perfect by any sense of the word, but it will give you a starting point. And also from the OSCA data, you'll be able to see what types of cultural venues and organisations they are, which was one of the other questions. It won't necessarily go into granular detail around when they're open and, you know, whether you need to purchase tickets, etc. But it's, again, a start of 10. And do these cultural organisations have outreach programmes? Without kind of scouring the internet, I don't think there's necessarily going to be a central source of information for that. But we did suggest that by going back to 360 Giving, GrantNet, whichever one it is, you should be able to pull a list of organisations that have received funding from various sources, and you should be able to filter those by those that have received funding for outreach programmes. So it would be a starter. It wouldn't necessarily be the whole complete picture.
That's brilliant. Thank you very much. Could we hear from the welfare group?
Tim, I'm just conscious of time. I'm just going to flag that we are recording, and if anybody does need to duck off because it's just coming up for 3:30 now, the recording will be available if you've got other places you need to be at the moment.
Thank you. Can we hear from the welfare group?
So Natasha had said that she's having microphone issues, so won't be able to feed back to the welfare group. If someone else is able to, then please feel free to jump in.
Okay, and so the other group that I haven't asked yet is the inclusion group, I think. Is that right?
Yeah, so a lot of what we discussed has already been covered, so I won't duplicate, but essentially we were talking about the gap between accessing services and when people, or if people are being diagnosed. So the gap between sort of actual experience and diagnosis. We also talked about waiting list times, which we understand are publicly available via the NHS. We didn't necessarily go into the detail that some of the others have provided with the links. We talked about sort of overlaying data with general population and how data could vary in quality and volume depending on the region that you're looking at. Some useful sources, there was the website which is already in the chat there, which is called undiagnosed.org.uk, which covers SWAN, Genetic Alliance UK, and one other which I've forgotten, Rare Disease UK. So there is also, one of our participants mentioned Genetic Disorders UK. So there's several sources, different organisations that can provide useful information on the age at which people are being diagnosed. And sort of in general, the rare disease community can provide a lot of that information in addition to government and NHS stats. We understand there is information from the government on employability and a map around digital access or digital exclusion, and also data on financial inclusion or exclusion. We didn't have the specific link for that. We also talked about this pupil census reports from schools and data that's already collected by schools about accessing services. Obviously the census itself, or the Office of National Statistics, which is updated more frequently, SIMD, which has already been mentioned, parliamentary reports, and the ASL review from the Scottish Government. I think that was the main ones that we discussed.
That's brilliant. Thank you very much. So we should have wrapped up by now. If there is anybody available from the other group that hasn't spoken, the welfare group, no. Well, we've reached the time limit now, so thank you very much, everybody, for your participation and involvement. And there's been some really good discussions going on in the breakout rooms, and I hope that you're going to take away some new knowledge from your peers. Thank you very much.
Thanks, everyone. I'm just going to pop a couple of links into the chat just before you go. We have a really, really short feedback form which should take you less than 2 minutes to complete. We'd be grateful to have your thoughts on the session. And Tim is doing another workshop with us next week, which the title of so many, the title has slipped my mind.
It's to do with the presentation of visual data. So it's to do with once you've found your data source, and it's about choosing. I can't remember the title myself, but it's about how you choose the most appropriate way to present that, and various different tools which can help you to make a convincing and attractive presentation or report.
Perfect. So Emily, I've just seen that you've said it's sold out. I will be prioritising people who have come to a previous workshop and people who are members of organisations that are grant holders from our sponsor organisations. So William Grant Foundation, Inspiring Scotland, the National Lottery Community Fund. There's two more. They're on their website. Slipped my mind at the moment, Friday afternoon. But if you do want to come along to one of those and you haven't managed to book on yet, can you drop me an email at jennifer@thirdsectorlab.co.uk and pop that in the chat now, and I'll make sure that you're booked on. Thumbs up. Thanks, Emily.
Right. Thank you.
Okay, other than that, I'll just close the session down now. I'll be in touch with circulating the slides and the recording shortly. Thanks, everyone.